Stage 6. Flexibility test for the quadratus lumborum muscle. Functional tightness of the quadratus lumborum limits the range of lumbar vertebrae flexion. It limits the range of lumbar vertebrae flexion. The quadratus lumbar connects the 12th rib, lower back vertebrae, L1 through L4, and the iliac crest. It helps in stabilization and extension of the lumbar vertebrae. And when one side works, it also performs side flexion. Tightness in this muscle tends to increase lumbar lordosis, and therefore it is important to test its flexibility as part of the set of lower back tests. Tightness in this muscle tends to increase lumbar lordosis. Test of lower back mobility during flexion. Subjective evaluation of quadratus lumborum flexibility. This is a subjective test that examines the reaction of the lower back to flexion. The patient lies on his back, knees flexed towards the chest. The practitioner brings the knees towards the chest until the pelvis slightly lifts from the ground. What is normal? Integrative free movement is created in the lower back. The pelvis easily lifts off the ground and the lower back is slightly rounded and allows smooth movement in both directions, vertebrae after vertebrae. What happens in a functional limitation? Muscle tenseness appears as functional rigidity of the lower back, which does not allow movement flow up and down. It is difficult to lift the pelvis from the ground and to round the back. If the practitioner feels a slight upward jump of the pelvis, there may be no segmental movement and all the lumbar vertebrae move as one unit. How can we know if the limitation in this test is created by muscle tenseness or structural rigidity of the vertebrae? It is very hard to perform a differential diagnosis here. Usually, the diagnosis is based on observation of the curve of improvement. In structural rigidity, the curve of improvement is lower after exercise, little potential for improvement. In functional rigidity, tight muscles, the curve of improvement is high following exercise. It should be noted that whether the problem is structural or functional, the movement therapy provided is similar. The variable component is the goal that is set. Even in cases of structural rigidity, it is very important to exercise mobility and muscular flexibility, both to prevent deterioration and to maximize existing movement potential.